is Get Well 101. In today's live broadcast, we're going to be talking about ear infection. Yes, you heard me. Ear infection. So, what is ear infection? What causes ear infection? What are the simple home remedy to help alleviate ear infection? And these are some of the things that we're going to be looking at today. Okay, so let's get started. So we said that an ear infection is inflammation or infection of the ear caused by bacteria, virus, or sometimes fungi. So in other words, bacteria, viruses, and sometimes fungi can cause an ear infection. Okay, so it can affect different part of the ear. You know, the ear divided into three parts: the outer part, the middle ear, and the inner ear. So we are saying that it can affect bacteria, virus, or fungal infection can affect different part of the ear. So the outer ear infection, commonly known as swimmer ears, the medical term will be otis externa, can also be affected by bacteria, virus, or sometimes fungi. The middle ear, which is the second part of the ear, the middle ear infection, medical term will be otis media, can also be affected by bacteria, viruses, or sometimes fungi. The inner ear infection. The inner ear infection is less common but more serious or more severe. The middle ear infection are especially common in children. So what causes ear infection? Middle ear infection, otis media, often happen after cold. In other words, common cold or flu can cause ear infection. Please kindly subscribe and like, okay, and share too. So the middle ear infection often happen after cold. So in other words, when you have a cold, after cold, your ear might be infected, the middle ear might be infected. Or when you have flu, the middle ear might be infected. Sinus infection can also affect the middle ear. Allergic reaction can also affect the middle ear. Blocked eustachian tube. Eustachian tube is the tube that leaks the middle ear to the inner ear and then to your throat. It can also block and get seriously ruptured due to pressure. So what are the common causes of ear infection? We said that bacteria like Staphylococcus pneumonia can cause ear infection. Viruses like cold and flu virus can also cause ear infection. So when mucus build up behind the eardrum, germs grow and causes infection. So the outer ear infection, commonly known as the swimmer's ear, can get infected, often caused by water trapped in the ear. That is why it is commonly known as the swimmer's ear. So when you go to the pool to swim, or you're taking a shower, you're trying to wash your ear, and water get in there, and water get trapped in your ear. If you don't have a way of removing it, it can cause or it can lead to ear infection and very, very painful. I remember those days when we were younger, we used to go to the stream to swim. we always end up having this ear infection, because after birth, you will find out that you stuck with ear. So what we'll do is I will tap the ear and tint our head, and sometimes you will see the water will drill out very, very warm. It will drill out. So if you don't get rid of it, that water can get trapped and get infected and can be really, really painful. So when water trap in your ear, it can cause infection. Always scratch your ear inside the ear. This can also cause ear infection. Using cotton swab or cotton bulb too deeply can also cause ear infection, because if you're using cotton bulb too deeply, it might irritate the ear canal. You can actually bruise the eardrum and bruise the ear canal, and you can get infected. Sometimes the cotton bulb might dislodge in your ear. I've seen that 1 million times in the emergency room. They bring people coming to emergency room with cotton bulb stuck in their ear. So if you are cleaning with a cotton bulb, just clean the wax that leaks out from for the middle ear. Don't go deep, because when you go deep, you're actually pushing back the wax. So just use the tip of the cotton bulb to clean the wax. Don't go in. Okay? Using cotton bulbs far too deeply, like I said, they can cause ear infection. Earbuds that are not clean can also be affected. Okay, so moisture allow bacteria or fungi to grow in your ear. So when somebody have cold and you look at their ear, you see how reddish, how uh, uh, you see how reddish and inflamed that eardrum will look like if they're having a severe cold or sinuses. You see that there. Okay, so common symptom of ear infection. Common symptom of ear infection will be ear pain, might be mild to severe, feeling of fullness in your ear. Okay, if you're having a common symptom of ear infection, that you'll be having a fullness in your ear. Hearing difficulty, drillage from the ear. Okay, mostly if you have abscess or sometimes the ear drum get busted or get ruptured due to pressure on the eardrum. You see, it can actually drain either pus or bloody drainage coming out from the ear. So those are serious signs of ear infection. Fever, most common in children when their ear infected, they have fever. So these are common symptoms of ear infection. Dizziness, inner ear involvement. Okay, if you're becoming dizzy, know that your inner ear is involved in this kind of infection. So this is severe. So severe pain, high fever, swelling behind the ear, or hearing loss need medical attention. Okay, so some simple home remedy to help alleviate symptoms. So important. This help relieve discomfort, but do not replace proper medical treatment if infection is severe. Okay, so you use a warm compress. Place a warm, not hot now. Place a warm cloth over the ear for 10 to 15 minutes. Then this help reduces pain and improve drillage. Mostly if your ear is affected, you have abscess. So this will help drill the busted pus out from the ear by placing a warm compress over the ear for 10 to 15 minutes. Okay, so rest and hydration also help reduce pain, ear pain. So drink plenty of fluid, and rest help your body system, help your immune system fight infection. So you need rest. So over the counter pain relief, acetaminophen Ibuprofen can reduce pain and fever following close instructions carefully. So keep ear dry for after ear infection. Make sure the ear dry. Avoid swimming if you're having ear infection. Gently dry ear after bathing. So have a way of cleaning your ear and make sure there's no fluid stuck in your ear. Okay, so do not insert objects into the ear, because this might irritate and bruise your ear and further worsen the infection. Okay, or further worsen the pain. So elevate the head while sleeping. So this help improve ear drainage. If you have abscess or your eardrum is your eardrum ruptured due to pressure, so for proper drainage from the ear, you may want to elevate your head while sleeping. So elevate your head and tilt your head to the affected side so that it can so that the fluid can drain out from your ear properly. Okay, you can use extra pillow if the need be. To avoid this, do not pour oil. I have seen people putting castor oil in their ear. I see people putting olive oil in their ear, all sorts of oil in their ear. Don't do that. Okay, do not put oil in your ear. So, or any herbal drops into the ear, less advised by a medical doctor. Do not do it on your own because you might get your ear infected. Do not use cotton swab deep into the ear. I have said that before. That I have seen people who cotton bulbs dislodge in their inner ear. They end up with the ER. So do not go deep. Just use the tip to clean the wax that comes out from the ear. Do not ignore symptoms lasting more than 2 to 3 days. If you have any symptom that is long, any system lasts than 2 to 4 days, do not ignore seek medical help. So when to see a doctor? Well, strongly advise you to seek medical care if pain is severe. We also encourage you to seek medical doctor care if fever is above 101 Fahrenheit or 38.3 degrees Celsius. Okay, symptoms last more than 2 to 3 days. Seek medical help. There is pus or bloody drillage coming out from your ear. You need to seek medical help. Your ear might be seriously affected. You might probably need some antibiotics or some medical antibiotics ear drops. So you need to see a provider to help you with prescription, diagnosis, and proper treatment. Okay, hearing suddenly worsen, you need to seek medical help. The patient is a baby under 6 months old, you need to seek medical help. Some ear infection need antibiotics, especially bacteria, middle ear infection. So you may want to see a medical doctor for proper prescription. Okay, so let's look at symptoms. What symptoms might suggest? So if you're having a pressure, like severe middle ear infection, otis media with rupture, you have pressure from infection. Pressure from infection can rupture the eardrum, causing pus drainage or bloody drainage. Sudden hearing loss, pain. Sometimes pain improve after rupture of the eardrum. So inner ear involvement, this is more serious. So if it involves your inner ear, you feel dizziness and hearing loss are present. It could mean infection spreading deeper into the ear. You need to seek medical help immediately. Or inflammation affecting the balance structures. This can sometimes lead to complication if untreated. Okay, so when to go to the urgent care or ER immediately? We'll encourage you to go to urgent care if you have severe dizziness. You feel you see the room spinning. You got to go to urgent care or ER to seek help immediately. You have high fever. your ear affected and it comes with high fever of 101 to 102, you need to seek medical help. If you have severe headache, you need to seek medical help. Swelling, inflammation the behind the ear, you need to seek medical help. Nausea, vomiting from dizziness, this is serious. The infection might have spread, so you need to seek medical help. Okay, facial weakness. The person is a young child. You need to seek medical help. And we say that keep your ear, what to do right now, keep your ear dry. Do not put drops or oil in the ear. Do not insert cotton swab in your ear, and use acetaminophen or ibuprofen for pain/fever reliever. Okay, sit upright if you are feel dizzy. Why this need a doctor? You may need a doctor because prescription like antibiotics for ear drop or oral antibiotics might be prescribed if having the symptoms I have just mentioned. Examination of the eardrum is also necessary, so you need to see a medical doctor. Possible referral to ENT specialist. Okay, so delayed treatment can risk worsening hearing loss permanently. And delayed treatment can risk spread of infection, mostly to the inner ear and then to the brain, or to the head, or to the brain, or to other vital organs. Okay, balance complication. Okay, so let's look at. Let's recap. Let's recap for the sake of those who are joining us. We are talking about ear infection part 2. I will say that an ear infection is inflammation or infection of the ear caused by bacteria, viruses, or sometimes fungi. And it can affect different parts of the ear. We have the external ear, which is commonly known as swimmer ear. We have the middle ear, commonly known as otis media. We also have the inner ear infection, which is less common but more severe. And we also say that middle ear infection are especially common in children. We also say that what causes ear infection, we say that middle ear infection, otis media, often happen after cold or flu or sinus infection, allergic reaction, block interstitial tube, that is the tube that leads to the inner ear from the middle ear then to the throat, is blocked. When it is blocked, this can cause serious ear infection. We also said that common causes of ear infection, bacteria like Staphylococcus pneumonia can also cause ear infection. Virus, cold, and flu viruses can also cause ear infection. So when mucus build up behind the eardrum, germs do what? Germs grow and causes infection. Outer ear infection, we say, or commonly known as swimmer ear, often caused by water trapped in the ear. When you sometimes scratch your ear inside the ear, you scratch inside the ear, it might get infected. So using cotton swab too deeply can also cause infection. Or there's also possible links of dislodge. Okay, so this can cause ear infection. Using cotton swab too deeply can also cause ear infection because you might bruise the eardrum and irritate the eardrum. So this might cause ear infection when you go too deep. So earbuds that are not clean can also lead to infection. Moisture allow bacteria or fungi to grow. So you need to clean your ear as much as possible. Common symptom of ear infection will be ear pain, mild or severe, depends on what part of the ear that is affected. Feeling of fullness in the ear, hearing difficulty, drainage from the ear, Fever, more common in children. Dizziness, it involves inner ear involvement. Okay, severe pain, high fever, swelling behind the ear, or hearing loss need medical attention immediately. Simple home remedy to help alleviate symptoms. I will also say that this help relieve discomfort, but do not replace proper medical diagnosis or treatment if infection is severe. Okay, so we say that simple home remedy to help alleviate symptoms. We said use warm compress. Place a warm, not hot, place a warm cloth over the ear for 10 to 15 minutes. This help reduce pain and improve. This help reduce pain and improve drainage. Okay. We also talks about rest and hydration. We said drink plenty of water. Rest help your immune system fight infection. We also said that over-the-counter pain relief, acetaminophen, ibuprofen can reduce pain and fever. Follow closely instruction carefully. Okay. Remember, we always encourage you to seek medical attention, that you should not take over-the-counter medication without prescription from your healthcare provider. Okay, so let your healthcare provider know before you take any over-the-counter medication. Okay, so we also say that keep your ear dry for after ear infection. Avoid swimming. If you already have if you have any ear infection, don't go and swim because it might worsen the situation. Gently dry ear after bathing and do not insert object into the ear. We also said that elevate the head of bed while sleeping because this helps drill the fluid out of your ear. Okay, and use extra pillow if the need be. Avoid these things. Do not pour oil. How about drop into the ear less advised by a doctor. Now, do not use cotton swab deep into the ear, because I've seen people who got a bulb dislodged in their inner ear. Do not ignore symptoms lasting more than 2 to 3 days. Okay, so when to seek medical help. So see a doctor when the pain is severe. We also encourage you to see a medical doctor if fever is above 101 Fahrenheit. We also encourage you to seek medical advice if symptoms lasts more than 2 to 3 days. We also encourage you to seek your medical provider if there is pus or bloody drainage coming from the ear. It might be a very serious infection. Heavily sudden worsening. The patient is a baby under 6 months. So some ear infection needs antibiotics, especially bacterial middle ear infection. So make sure you seek medical help so you can get prescriptions. Okay, so we also said that pus drainage plus dizziness plus hearing loss together is not a simple ear infection. This is severe. This needs medical evaluation as soon as possible, today if possible. Okay, so what this could mean, this symptom may suggest severe middle ear infection, otitis media, and with rupture. Pressure from infection can rupture the eardrum, causing pus drainage. Okay, sudden hearing loss, pain. Sometimes pain improves after rupture. So inner ear involvement more serious. If dizziness and hearing loss are present, it could mean infection spreading deeper into the ear. Inflammation affecting balance instruction. This can sometimes lead to complication if untreated. So I strongly encourage you to, while this does not constitute diagnosis and treatment, we strongly encourage you to go to the ERO All urgent care. If severe dizziness is noted, you feel the room is spinning, you need to go see a medical doctor immediately. High fever above 101, you can also seek medical attention. Severe headache, seek medical help. Swelling behind the ear will also encourage you to, if you're having all this symptom, will encourage you to seek medical help. Facial weakness will also encourage you to seek medical help. The person is young, a child. The person is a young child will also encourage you to seek medical help. Why this need a medical help? Prescription antibiotics, ear drop, or other medication exam need to be prescribed by a doctor. Examination of the ear done, the doctor need to properly examine and diagnose you, possibly referral to ENT specialist. Okay, delayed treatment can risk worsening hearing loss. Delayed treatment can risk spread of infection, mostly to the inner ear or beyond. Delayed treatment can risk balance complication. Okay, so let's take a look at some simple home remedy to prevent ear infection. Okay, how can we prevent ear infection? I would say that ear infection, especially the middle ear infections called otis media, are common in both children and adults. The good news is many causes can be prevented with people habit. So let's dive into it. Number one, fever, cold, and upper respiratory infection. Most ear infections start after cold. So proper hygiene, proper hand washing, and frequent hand washing will prevent infection. Avoid close contact with sick people. Clean and sanitize commonly touched surface. Avoid touching your face, nose, ear, and mouth with unclean hand. Respiration virus causes swelling that bloody the interstitial tube, the tube connecting the ear to the throat, leading to fluid buildup and infection. Okay, so we are saying that Vaseline help prevent infection that can lead to ear infection. So flu Vaseline reduces flu-related ear infection. Pneumococcus conjugates Vaseline protect against common bacteria that cause ear infection. We also said that you should avoid smoking if you're having ear pain because smoking and secondhand smoke cigarettes irritate and inflame the middle and interstitial tube, increasing risk, especially in children. If you walk quietly, especially lower, if you smoke, quit significantly because this will lower ear infection risk in your household. And manage your allergies because allergy can cause nasal swelling and fluid buildup in the ear. So control dust, control mucus, and control pet damage. Use allergy medication if prescribed. People keep indoor air clean. Okay, so breastfeeding for babies. Breastfeeding for a 6 month help strengthen baby immune system and lower ear infection. So proper feeding, promotion for infant. Avoid feeding habit while they are laying flat. Keep the head elevated to prevent milk from falling into the middle ear. So keep ear dry, prevent swimming if you have an infection. Dry ear gently after swimming or showering. Tint hair to drip water. Use earplug when swimming if prone to infection. And also encourage you to avoid inserting cotton swab deep into the ear. So don't over use cotton swab, pushing object into the inner on damage the ear canal. This can also push wax deeper, increasing the risk of infection. So the ear usually clean itself. Okay, strengthen your immune system. Eat a balanced diet, get enough sleep, exercise regularly, manage chronic inflammation like diabetes. We also said that we want to seek a medical help. We say seek medical help if the pain becomes severe. You having a fever, seek medical help. You have fluid or pus draining from the ear, you need to seek medical help for possible antibiotics. Okay, hearing loss symptom lasting more than 2 to 3 days, seek medical help. Okay, this is Get Well 101. Thank you all for watching. Remember, this does not constitute diagnosis or treatment. We strongly encourage you, if you're having one or all of the symptoms I've just mentioned, go and seek medical help immediately. This is Get Well 101. Thank you so much for watching. Till we come your way again. Stay blessed and bye for now. Thanks.